Ever wondered about the correct order of phlebotomy draw? It's essential for accurate results. Phlebotomy draw, in layman's terms, is the process of drawing blood for medical testing. It's a procedure that's as common as a morning cup of coffee in the healthcare world. But here's the catch. It's not as simple as just sticking a needle in a vein. The order in which blood is drawn into different tubes is crucial to prevent cross-contamination between the additives used. Now that you understand the importance, we will delve into the correct order of phlebotomy draw. The order of draw starts with blood culture bottles or tubes. These are the first in line because they're extremely sensitive to any contamination. They are typically collected when a blood infection, also known as sepsis, is suspected. The purpose of these bottles or tubes is to cultivate any bacteria or fungi present in the blood for further examination. Next up, we have the sodium citrate tube, identifiable by its light blue top. This tube is all about clotting, or rather, preventing it. The sodium citrate inside acts as an anticoagulant, keeping the blood from clotting while it waits for testing. It's often used for coagulation studies, such as the prothrombin time test. Following this, we have the serum tube, which may or may not contain a clot activator or gel. It's easy to spot with its red or gold top. This tube allows the blood to clot, and the serum, which remains after the clotting process, is used for various tests including hormone levels, drug monitoring, and disease detection. Next in the order is the heparin tube, with or without a gel plasma separator, marked by a green top. The heparin inside this tube also acts as an anticoagulant, but in a different way than the sodium citrate. It's usually used for chemistry tests, like electrolyte panels or enzyme studies. The fifth step involves the EDTA tube, recognized by its lavender top. The EDTA inside this tube is yet another anticoagulant, preventing the blood from clotting by binding to the calcium in the blood. Common tests performed with this tube include complete blood counts and genetic studies. Lastly, we have the glycolytic inhibitor tube, distinguishable by its gray top. This tube contains a substance that stops the blood cells from using up the glucose in the blood, making it ideal for glucose tolerance tests and lactic acid measurements. These steps are not random. They follow a specific order to prevent contamination and ensure accurate results. By adhering to this order, medical professionals can ensure the highest quality samples for testing, leading to more accurate diagnoses and effective treatment plans. The correct order of draw is not just a guideline, but a necessity in the medical field. Now let's recap the order we've discussed. It starts with blood culture tubes, then coagulation tubes, serum tubes with or without clot activator, and so on. Each step in this sequence has a purpose, and it's essential to adhere to it meticulously. Imagine if we jumbled up the steps, what could happen? The potential consequences are serious. Incorrect order of draw can lead to cross-contamination between tubes. This can cause inaccurate test results, which in turn can lead to misdiagnosis. The wrong diagnosis can be fatal. It can lead to inappropriate treatment, unnecessary distress for patients, and even loss of life. A simple misstep in the order can have a snowball effect, leading to grave consequences. So, what does this all boil down to? It emphasizes the importance of the correct order of draw for patient safety and accurate medical testing. It's more than just a protocol. It's a safeguard against errors. It's a set of instructions designed to ensure that each patient receives the best possible care. In conclusion, the phlebotomy draw order is not just a series of steps to be memorized and followed. It's a crucial part of the healthcare process that ensures accurate test results and, ultimately, the health and safety of patients. Remember, the right order of phlebotomy draw is essential for accurate test results and ultimately patient health. It's not just about drawing blood, it's about doing it right.